Welcome to Shikshan Setu Dialogues, where we explore the future of education and careers. Today we have with us Dr. Aditi Lele, an accomplished dentist with 14 years of experience. She holds a BDS from Terna Dental College, MDS in Oral Medicine and Radiology from Manipal. She is certified in dental implantology from Germany. She specializes in aesthetic and implant dentistry in her clinic, Smiles Forever by Dr. Suhas Lele. And today we are going to explore the future of dentistry in the age of AI, the career opportunities in this evolving field. So let's welcome Dr. Aditi Lele. Hi Aditi,
Hello,
welcome on
hi.
Shikshan Setu Dialogues.
Hello, hi everybody.
So I have already introduced you,
Oh, really? Okay.
yeah, with your implantology and everything. Uh, well, Aditi, tell us something. How was this decision made? See, our primary viewers are students,
Right.
parents who are aspiring,
Hmm.
not necessarily dentists, because they don't know yet what they really want to become,
Right.
right? So, how did your journey start? Please tell us.
Well, to begin with, I am a second generation dentist. So,
Okay.
my father, Dr. Suhas Lele, he's a dentist, and growing up in my childhood, I've seen him practice, going to the clinic, coming back, discussing with me. Oh, today what happened? A patient came in, or and he used to tell it in a very funny way and a jovial way. Like I never felt that. I thought it was very easy. Oh, nice, yeah. He fixed someone's smile, and then they were very happy, and they got us few things as a reward, which he would often get home. And it was all a goody goody picture. It still is, in fact, touch wood.
That's good.
So in a kind of a way, he was a role model for me. Looking up to him, like, oh, even I can choose this career path, or even I can become a dentist. And he being in the academics as well. So it was my parents decision as well, that at least the elder daughter should become a dentist and carry the family practice ahead. So now we are a family practice, where me, my father, also my sister, a cousin who works with us, and we all run it as a family practice. So that made me come into dentistry, and that was the starting point, that I sort of steered, you could say,
Mm-hmm.
towards that profession.
Okay.
So that made me become a dentist.
Right.
Yeah.
Wow. So for you, okay, so you're a second generation dentist. But then for someone
Hmm.
who is not a second generation, I mean, there's
Right.
no mummy papa who are in
Right.
dentistry
Right.
and wishes to join this as a career or take this up as a career.
Right.
Uh Now since you're practicing for past 14 years or
Yes.
more, I
Yes.
think, right?
Yes.
What are the skill sets that are required, like maybe as a kid, like what is it ke bhai mujhe dentist banna hai, so
Hmm.
it can't be just simple as that, right?
Right, right. No, I mean, now the education system or the reforms have, evolved, and they are evolving. So, for one instance, when I was for my further education in Germany,
Mm-hmm.
I remember that there were a couple of young boys and girls who had come to visit the clinic.
Oh.
I first thought they were patients, but no, they were university students, or who were planning a higher education. Like they had finished their 12th standard maybe in Germany, and they had come to experience what a dental clinic looks like, or
Oh.
how a dental practice, what is a dental practice,
Mm-hmm.
how dentists are working, how is their collaboration, how is the team working, how many assistants, and all that. So they got a practical knowledge to see, like how you intern with somebody. So they
Right.
were there for a couple of days just to see and experience that, oh, this is a dental clinic.
Mm-hmm.
म्हणजे आपल्याकडे or in here, in play school, they are introduced as
Yeah.
community helpers.
Correct.
I also remember in my son's class that I went, that dentistry is a community
Yeah.
helper. But after that, I don't think there is any touch. In
Ex-
fact, kids are scared of visiting a dentist. Parents are all the more scared of taking their kids to the dentist because
Correct.
of obvious reasons, pain, injection, all that. So but dentistry has evolved and is evolving a lot,
Mm-hmm.
and choosing dentistry as a career is a great option, I would
Mm-hmm.
say, for for students who want to step into dentistry and do something. So it's and with AI coming in, it's just changed the ball game altogether,
Okay.
dentistry. So it's more of AI integration. There are scans, there are intraoral scans. So it's more like, somebody who is interested in a video game and they want to just merge and match
Wow.
pictures and scans, and there's too much AI coming into dentistry and still is.
Okay.
So it's a good career option, I feel, for young
So,
students.
so you mentioned AI is coming in dentistry,
Yes.
yet it is a good career option. Why
Right.
I am coming to the question, I'll tell
Right.
you.
Right.
You see these reels which are trending. AI आपका job ले रहा है,
हाँ
you
हाँ
know.
हाँ, नहीं, डेंटिस्ट्री में एआई आपका जॉब कभी नहीं ले सकता.
Yeah,
You have to have a human touch and a feel and the skill
correct.
to become one with AI and use it to the maximum. You can't beat. I mean, AI can't beat you when it comes to
Absolutely.
emotions, or showing some concern towards the patient, or whom you are treating. Because of the end of the day, you are going to see that patient walking with a great smile and thanking you. So AI cannot do that for you, but AI coming in the dentistry has reduced the timeline of the treatment a lot, and is
Okay.
reducing, like, we pioneer in one visit dentistry. We can do too many things in under one roof in one appointment. You don't have to wait for a root canal to happen like over 15 days, or 2 sittings, 3 sittings. It can happen in one go. We can do the cap or something also in the same day. So that's where AI is integrated in the practice, and
Right.
it's still evolving.
Right, right. Wow. And I can actually vouch for that, being the patient for so many years now.
Yes, yes, yes.
So, tell me something. What are the myths uh, that you think are, you know,
Mhm.
taking rounds out
Mhm.
there
Mhm.
in the minds of students and parents about dentistry?
Well, in the earlier times as well, like when my father graduated, there was a concept that if MBBS को admission नहीं मिला, तो
Huh.
the second option is
Is it
business.
is it still true? Because I
Uh,
see still
yeah, there is
for
there is
career.
a
Yeah.
bit there is a still bit of doubts or concerns that कि dentistry में जाके क्या
Huh.
करेंगे, या what. I can understand from a completely who do not have anybody, or maybe any
Mm-hmm.
of the family member, maybe
Yeah.
as a dentist, they would have their concerns and doubts, because again, investment is quite a bit in dentistry, because as I said, machinery, the
Absolutely.
AI coming in, the initial investment to set up a clinic,
It's
it's
massive.
massive, it's massive. But the skill set, or the what you call as return on investment, that is something a dentist or the student can aim up to and desire up to, and
Mm-hmm.
they can learn. There are too many things abroad as well as in India, where students are trained to how to become good clinicians, I would say. There's a lot of theory which is passed on in the colleges. The college curriculum also needs a little bit of a change now, because it's been the same
Yeah.
as what is when I passed out, say maybe 15 years ago, but still the same things are applicable,
Is it?
or they are being taught. So that needs a little tweaking.
Hmm.
Like,
Hmm.
it has to become more relatable to the practical world.
Right.
Like when you pass out, what are you going to be? Of course, the basics are basics.
Correct.
You have to know the basics, because then later, as my dad says, what you don't know is basics, and you cannot forget that.
True.
So that is the most important.
Correct.
But you need a little helping hand after you graduate, or after the internship. But there are quite a lot of courses,
Hmm.
like continuing the dental education, which is there. So they happen and they train young dentists to
Yeah.
um,
So, in order to become practice ready,
yes,
that is something that
yes,
is
exactly,
required.
plastic ready, because in the college, it's it's what do you call, it's the same, and
Correct.
same
It's
thing
very
what happens,
bookish
it's
or
very
maybe.
bookish, or happens, there's not a situation where you can handle how
Hmm.
to handle a patient, because the
Correct.
onus
Correct.
falls on the university or the college.
Hmm.
We खुद का responsibility say
Huh.
you don't work sometimes in the college, but when it's your own practice, you have
Hmm.
a responsibility on your head that the patient should leave happy.
Yeah, I think experience teaches us the best,
Yes,
right?
yes,
Experience is the best
that's
teacher then.
yes, yes, absolutely,
So वो
absolutely.
कॉलेज में आप जो भी सीखो बाहर निकल के,
Yeah, you have to face the world, and
yeah,
situation clinic, every situation is different, every clinic is different, every tooth behaves differently. So, we have 32
yeah,
teeth in our mouth, so every tooth has its own story to tell.
wow,
So the scope
every
is
truth.
vast.
Scope is vast, and the myth that you mentioned कि MBBS में admission नहीं मिला इसके लिए BDS ले लिया.
हाँ.
But I also have dealt with some students who want to choose dentistry, even if they are not from the dentist family. They say, "Ma'am, root छोटा है ना
Huh,
MBBS से."
huh.
Is it true?
Exactly. No, that is also one reason why
Mm-hmm.
even females, a lot of girls opt
Mm-hmm.
for dentistry. If you see the ratio of boys and girls, there are maximum number of girls who are passing out now.
Oh,
From dentistry. Of course, I cannot put it that way, but एक tag लगता है.
yeah.
People say like
Huh.
लड़की.
Yeah, yeah.
I don't want to go down that line, but
No, no, I
but
get
but
the.
there are few who say that okay, she's a dentist and
Hmm.
a professional, and
Hmm.
that is a career path which the parents choose for the
Oh,
girls.
huh.
But ultimately that is a very sad part, which we also, like, we have associates with us, young girls, but they get
Hmm.
married, and then their
Hmm.
career comes to an end, or sort of, there is a break. I know even I took a break when I had a kid,
Yeah.
everything, but I bounced back. I'm now a
Yeah, yeah,
full-time
absolutely. You're a
practicing
full-time
dentist
practicing
in dentist.
dentist.
So there still, it may be off topic, but still our community, or that लड़की ने थोड़े देर ब्रेक लेके बाद में घर
Hmm.
गृहस्थी और बच्चे,
हाँ,
and
हाँ, हाँ.
with that phase still, we have to come out, we have to evolve still, I
Hmm.
feel.
Hmm.
There are few strata of society where we feel, or she's such a good student, or she has a skill set which
Hmm.
can be developed. But if there is a certain amount of break, a 2-year break or a
Correct.
3-year break, you lose that touch, you lose the touch, basically, of clinical dentistry. If you're
Absolutely.
reading, if you're in academics, it doesn't matter, but
Yeah.
once you lose that touch, it is a little difficult to get back,
Right.
or you have to really strive hard to do that.
Yeah.
But the female dentists still face an
Hmm.
issue. I mean, young girls I'm seeing, not of my
Yeah. Yeah.
generation,
That
but
has to change.
the younger generation, even,
Oh.
I'm getting married, and what, moving outside, but then our degree is not valid outside. You
Hmm.
have to give exams. You have to, in the US, there
Correct.
is a separate exam set which you have to give. In England, there is ORE, and
Hmm.
everywhere. In
Hmm.
Australia, there are different entrance
Correct.
exams which you have to pass out.
Correct.
So that cannot put an end to the career.
Correct. No,
Sometimes I
absolutely.
feel,
The
yeah.
girl students need to think about this now. It's high
Yes,
time, right?
yes, yes, absolutely. And there is, I mean, biologically, age-wise, you can't restrict yourself, of course, but that comes in a time frame where, you are at the peak of your career,
Yeah.
then you get married, you have to have kids. So that cycle somehow, I mean, the girl has to be strong enough, to balance
Absolutely.
all that. And of course, the supporting partner has to be equally involved and equally supportive in that
100%.
manner.
100%.
Yeah. So.
100%. So thank you for, I don't mind diverting because it's really important what you
Yes,
mentioned.
because you spend so much of time, so much of
Yeah.
money. Even if the duration is less, still it's a 5+3 course, like 4 years of BDS internship and a 3 years master's degree. So it's not a short period.
Hmm.
Even if
Hmm.
you're not opting for MBBS and doing
Yeah.
BDS or
Yeah.
MDS, you have to do masters in this age. I mean, I feel there is no second doubt about it, that you
Correct.
cannot stop at a BDS, Bachelor of Dental Science. You choose, there are 8 9 branches in dentistry, now, like, and equally respected branches. It's not that a BDS is doing all the things. Now
Correct.
it's more of a teamwork. Even we have 6 doctors with us, who specialize in their own field.
Field.
Yeah.
Wow.
So me and Dr. Lily are there, but with us we have a very good team who is looking at the gums, who is looking at the root canals, who is looking at you have impacted to wisdom tooth, अक्कल that,
Hmm.
जहाँ किसी की अक्कल चलती नहीं, that is wisdom tooth. So we
Ah,
have to take, so there are oral surgeons for it. Then
right.
the gums are the most important, besides teeth,
Hmm.
which help to house the teeth
Hmm.
perfectly. So the gums are too important. So there is a periodontist for it. Those who fix the crown and bridge, that's called a prosthodontist. So there is a term called as conservative dentistry, where you do small. Conservative is like we are really conservative. We can do a small filling. Not
Oh,
not necessarily every tooth has to go for a root canal and then
right.
cap. If
Correct.
caught early, it can be saved, and a small filling can also do a good job for you, which can last years together. So there's a lot of scope.
So all these, so actually that was my next question. Thank you for covering that up. Because what you mentioned, all these different specializations,
Right.
so they come at masters and
Yes,
yeah.
in the
So
internship,
yeah.
when you go to every department to experience,
Uh-huh.
that's a specific branch. Like
Hmm.
you are in the conservative dentistry department where you do fillings and you do root canals. You
Right.
go to the periodontology department where you have they teach you how to take care of your gums, and
Hmm.
if now implants are becoming popular day and age, so implant dentistry is a little bit of introduction is done in
Mm-hmm.
internship. There is a separate branch of orthodontics, that is braces, conventional braces
Ah,
or
okay.
aligners. Now aligners is the talk of the town. Everybody wants to get those clear aligners.
Right.
So that is a specific different branch where
Hmm.
you are MDS, masters of it, and then you can join a practice or have a practice of your own as an orthodontist and start straightening people's teeth and giving them a good smile. So there's a
Wow.
lot of scope. There's preventive health dentistry also. Not very popular, but it has a lot of weightage where you conduct camps in colleges. You go to spread awareness
Oh.
of related to dental hygiene, oral hygiene, everything. Academics also, where if you're interested in academics and
Mm-hmm.
research, you can choose preventive health dentistry and
Oh.
then go abroad and do, if you want to get into research. So also there is scope.
Acha. So in dentistry also there is
Yes,
research
yes, yes.
oriented.
It's a very limited, when you have to find out that correct channel to go through.
Uh-huh.
But there is a lot of
That's
scope for
interesting.
research. In India, not much, but
Mm-hmm.
yes, outside definitely.
Interesting.
Yeah.
So while you were explaining, you mentioned about you can also establish your own clinic.
Yes.
So if at all someone wishes to establish own clinic,
Hmm.
that means apart from being a dentist, that person also has to become an entrepreneur.
Oh yes, yes, absolutely. No,
Right?
no, no. Yeah.
So what skill set is required, and what I mean, what is it that they actually are going to require? Is it like a huge investment that is, you mentioned about it, but
Yes,
can you
yes, and
elaborate?
also entrepreneurship, and even this is something we should have a lecture on
Mm-hmm.
how to become an entrepreneur,
Hmm.
or how to manage our accounts.
Mhm.
Like there should be a lecture for us, like a chartered accountant, that should
Correct.
come and tell us, yeah, like what is your investment, how are you going to do the return on investment. I am getting introduced to it, like now, like still I know. I mean, we have been in this field for 15 years, but still now we feel that, अरे ये पहले किया होता तो, या so that knowledge, or that you have to have that in your mind, that we are investing, or
Hmm.
you are becoming an entrepreneur now, because when you're
Yeah.
setting up a business, now there is a very thin line whether how you want to run it as a business, or you want to run it as a successful clinical practice.
Ah.
Now there are too many clinics. If you see chains of dental clinics which are coming up, there
Correct.
are, so there they have something called as a target practice, where
Hmm.
that is not where, like, private clinicians like us are not happy with that kind of a model. But if you ask me from a business point of view, or an entrepreneurship, that clinic might be doing well on the books.
Hmm.
Account books of accounts are
Correct.
really good.
Correct.
Whereas our clinic, or where patient is more centric. Of
Hmm.
course we
It's
have all the means, yes, but if we want to do something extra, we absorb the cost.
correct.
Or sometimes it's done, okay, this is going to benefit the patient, let's not do it this way, let's
Hmm.
change our way, where maybe we want to integrate something more. and it's going to cost us more, but then it's at the benefit of the patient.
Correct.
But whereas the clinics or the chain of clinics which are springing
Hmm.
up, there even the dentist or he's pressured that it's a target practice, so
Yeah.
you have to meet the numbers. So there, the dentist has to decide which way
Yeah.
he has to follow.
Absolutely.
Actually, money is important at the end of the day for
Correct.
everybody.
Yeah, yeah.
But what line to choose? Somewhere middle ground has to be
Achieved.
sought or
Yes.
achieved that way.
Absolutely.
So yeah.
Yeah. Okay. Those are really good insights, I
Yeah.
think so. You're clearing a lot of doubts for
Yes.
the students and
Yes.
parents.
Yes.
So, the final question before we end this conversation, um, if you have to give one advice to the students who are right now preparing for NEET
Hmm.
and entering this
Hmm.
11th and 12th students, what is it that you will tell the students and parents?
Yeah, students, I mean, they have to study and really crack the NEET, because NEET
That is the
के
option.
सिवा और कोई option ही नहीं है. मतलब during our time we had 2-3 exams which we had to give.
हाँ.
NEET was not there during when I
Correct,
passed
correct.
out. So I had to give a Maharashtra state exam,
MHCT.
MHCET, then I mean few deemed universities were
Correct.
there. So we had to give those exams,
Entrances.
entrance exams, and then we would choose,
Yeah.
wherever we would
Yeah.
go. But right now, NEET option ही नहीं है, so you have
Yeah.
to score well in NEET. So study hard,
Hmm.
and yeah, whichever college gets you, you just go and
Yeah. Enter the stream.
enter the stream, and then once you pass out or once you have a know-how, there are too many options to upgrade your skills and skill set. So don't be afraid, or just plunge, dive into it, dive
Okay.
into the career. It's really good.
Oh, superb, superb. Thank you so much. This was a very, so these days we don't make long format videos
Mhm.
because the attention span of
Right.
people has reduced drastically.
Right.
So we try to make it concise and we try to answer all the possible questions through these videos.
Sure.
So thank you so much for coming on our show today
Yeah.
and explaining all the students and parents about the future of career in dentistry.
Yes.
So
My
thank
pleasure.
you.
Thank you so much.
Thank you. And keep watching Shikshan Setu Dialogues, Future of Education.